Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, or CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment, such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity. On any given day and at any time, you could encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There is more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the 2 adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. Both chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the in-hospital chain, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate. For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions.
Because most adult cardiac arrests occur at home or in other places that are outside of a hospital, we'll look at the chain of survival for an out-of-hospital cardiac arrest first. A son drives his father to a doctor's appointment. The father collapses, and his son realizes that he needs to find help. A nurse runs out of the doctor's office and tries to get a response from the father. She recognizes possible cardiac arrest and sends the son into the office to call for help and set the emergency response system in motion.
The chain of survival begins right here, with the nurse's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must first recognize the signs of cardiac arrest, such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should immediately activate the emergency response system and begin high-quality CPR.
Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The nurse begins chest compressions without delay. The office assistant summons another nurse to help. The second nurse arrives with the AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight, portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
Once EMS providers arrive and take over, they provide advanced life support. This extends the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the person.
After the person achieves return of spontaneous circulation, or ROSC, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that need to be performed when you suspect someone is in cardiac arrest. First, assess the scene quickly to make sure it's safe for you and the victim. Then, simultaneously check for breathing and a pulse.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and a framework to provide high-quality, life-saving CPR regardless of the conditions and circumstances.